Hey, welcome. I'm Dr. Ruth Roberts. I am so excited that you've joined us for our Holistic Dog Care Symposium on petsummits.com. I hope you've enjoyed the speakers for today. Before we get started on the questions and answers, I want to make sure that we thank our sponsors for helping us put this program on so that you can learn more about how to help your pet holistically. So, first up is Chi Dog, who makes amazing fresh food diets based in the traditions of traditional Chinese veterinary medicine. Dr. Susan Barr is an expert and has been an amazing friend. Pets Pimp makes, I think, what is the most important tool in your arsenal to support your pet in many facets of their life, and that is a pulsed electromagnetic field therapy mat. I think it's a very a good deal financially. It has the ability to support your dog for both anxiety as well as pain and accelerated healing. Weld Pet Dispensary, Dr. Rob Silver's done a masterful job throughout his career for others, and now he is bringing some amazing products he's designed for himself. And last but not least, certainly Animal Biome, the originators in the field of microbiome medicine, helping you test and understand what's going on in your dog or your cat's microbiome, as well as providing fecal microbiome transplant capsules. So, again, hope you have had a great day. I think what you had a chance to watch yesterday, actually, is Dr. Judy Morgan speaking about health conditions like kidney disease, learning about every piece of the puzzle, traditional checkups to alternative therapies. Dr. Eor Basco was kind enough to support us in learning more about using cooked food and plants to treat disease. And then Dr. Ian Billinghurst gave us his perspective on 30 years of whole food. And Dr. Peter DeBias was kind enough to join, and we had a marvelous interview talking about the potentials of anti-aging research and extending your dog's vibrant years and learning how to use supplements in a different way. And then lastly, I gave a talk about overcoming spay neuter syndrome. And I think this is one of the things that Peter DeBias and I share a passion for, supporting pets that have been spayed and neutered and then had chronic health issues pop up that were previously unknown or unconnected, but we do have those connections now. So for those of you that are here joining us early, we are super happy to answer any and all questions. And I'll kind of pause for a moment, see if there's any questions out there, but I think we're hanging tight. The other thing I want to make sure you know about is that following the summit, you will have the opportunity to purchase a course I created about supporting your dog's holistic kidney disease. And this was a really amazing course. It was really fun to pull it together. It's part of my new pet parent course, where we give you the basics on how to support with home cooked food, the original crock pet diet, and support kidney disease, not only this, but also gut health, all that good stuff. So let me know what questions you've got, and I'm happy to answer them. I've got my buddy Hio with me today. She's sleeping, as she often does, but she's always here in the background with us. Cool. So let's see, not much happening on the question format. So let's see, what else can I tell you a little bit back? So it's interesting. The speakers we had Monday were all aligned on a similar purpose, right? Because we're trying to give you options using multiple venues, food, supplements, and then help you understand how to support your pets. So that's part of why we're all in this together. We may come at it with a slightly different approach, but it's great in terms of getting different perspectives. And you may hear something from one speaker that makes you think, yeah, that's what I really need to do next. So I think that's important to make sure that you are listening with your ears open and with your heart open, so that when there's a different perspective that makes you think, yes, I need to look into this, you can take action on that. I think we often get blindsided in terms of we know this path and this is the only path. And I think that that is a serious mistake because we sell ourselves short and our pets short by taking it. And cool. And Audrey, great to see you. So if we do a vasectomy on dogs, will they get aggressive and start marking? So for those of you, when we're talking about spaying and neutering alternatives, because we do know that if we spay and neuter early in life, and often even before the age of 5, that our pets our dogs especially, can face chronic health issues. And what does that mean? So for instance, Dr. Michelle Kutzler created a great deal of research looking at why are pets having such serious health concerns when they weren't 10 years ago. And what I've found is that she helped me connect the dots into understanding the impact of losing all of your hormones or never becoming endocrine competent. So as a result, many of us are starting to talk about, okay, if we don't want to spay and neuter, what are the options? So ovary sparing spay, where the uterus is removed, and vasectomy are two amazing options in the United States. And a vasectomy for dogs is just what it sounds like. We're literally tying off the tubes so that the sperm cannot transit from the testes to the exterior of the dog and impregnate a female. So there's a big misconception that neutering will reduce aggression. And as it turns out, it actually can increase it because there are luteinizing hormone receptors in the brain. And luteinizing hormone is what goes massively up in our spayed and neutered dogs. So often, by keeping these guys intact, we actually are able to help them help themselves in terms of controlling their aggressive behavior. And then marking, we'll see neutered dogs do this as well. So part of it is just educating the dog about what's okay and what is not okay. Now, there's a few situations, like I had a 90-pound friend who at 80 decided to get a Dog de Beauceron, which is a really huge shepherd type dog. And this dog was young, he was very full of drive, but he was just literally dragging her down the street in many cases. So in that situation, we said, yeah, I think this would be appropriate for you to neuter him because his drive is so high and you are physically not able to keep him under control with that high drive. So everything you do, you have to consider what's going on in your home, the other dogs and cats that may be in your home, children, etc., and then go from there. So Audrey, that was a very long-winded answer, but no, doing a vasectomy will not make this dog get more aggressive or start marking. And Ruth, great to see you're here. I was just in the UK at the Natural Dog Expo on Sunday, April 27th. Amazing group of people. So she just listened to Dr. Robert Silver about mushrooms, and which is great, and understood one purchases the relevant one in bottle form, but can give us a pure mushroom. So go buy the mushroom and give. Actually, you want to cook these. So it depends. So you've got a kitty picture up. And so the volume that you would need to feed of the real mushroom is really quite small. So for humans, we know that 2 button mushrooms 3 times a week. So I'm just talking the simple, easy, everywhere you go in the grocery store, button mushrooms that people put on pizza, et cetera, that amount will increase our lifespan and our health span dramatically by something like 4 to 5 years. So for cats, if we extrapolate that backwards, then something like a quarter of a teaspoon, couple of times, 2 to 3 times a week should be sufficient. And that's what's really cool. So you are able to purchase fresh versions of these functional mushrooms like lion's mane, reishi, shiitake, turkey tail, that kind of stuff in the grocery store. Reishi's a little taste-wise is a little difficult, but shiitake, lion's mane, oyster mushroom is a great one. Tremella is great if you can find that dried often in the Asian stores. Those are all fantastic options. And so if you just do a little bit of something every day, I think that's a great option. You should cook them though, because that's how those active ingredients get released outside of the chitin or the shell of the mushroom. So options are available. And then certainly if you've got something you're treating or supporting your pet for in terms of an actual health condition, that's where the supplement versions can be very helpful, because we take those into an extracted form at a much higher concentration. So those functional qualities are delivered in a very high concentration. So in the UK, actually, I met a guy, Hemp Heroes, who's got some mushroom tinctures, and he's out of Ireland, so that may be a little bit easier to you. But I know Dr. Rob is working on getting things overseas, but that may be a little ways out. Cool. So not sure what else is up there in terms of questions. Glad to answer any and all that you throw up here, because we're here to help you guys out. One of the things that I enjoyed tremendously about the interview with Dr. Billinghurst was his perspective. And like many of us, I'm 35 years into veterinary profession. He's probably closer to 40, and he had sort of a different career than I did. He started out in terms of wildlife management. But what he started to understand is that something was wrong with his patients when they were eating this kibble that they said, oh, you need to feed this stuff. And so what he started finding was that he went back to the way the farmers fed their dogs. And, that's whatever was left over from the cow or the, in his case, the kangaroo or whatever animal had just been slaughtered. So that involved a lot of raw meaty bones. And so he took that learning that he saw in the field and started applying that to his patients. And lo and behold, they started getting better. So that's what I love about the power of observation or empirical medicine. And that means using what you have seen in order to do better in supporting your patients. A lot of things we talk about now is all about double-blinded placebo-controlled studies, and those are important from a scientific perspective, but I think we've let go the importance of the number of years that a practitioner has and the value and the insight that they can bring about cases without the studies. So Ruth, back to your question about a small dog. Yes, about the same portion. So if your pup is under 10 pounds, cat dose, if it's 10 to 20 pounds, then I would double the dose. And I did enjoy the UK very much. It was a very quick trip through London, Bath, and then up to Birmingham for the summit. But it's a place I'll be back to very soon, I hope. And Suki, good morning to you. Glad you're here. One of the other talks, so Dr. Morgan started talking about using overlooked signs of kidney disease in dogs, and how using your knowledge of what those signs might be, plus some additional testing, you can really change the outcome of how kidney disease goes for your pet. And I've seen this in my own practice as well. If we catch this early and we start doing things like increasing moisture in the diet, and also using things that are going to help support reducing inflammation at the level of the kidney. So things like omega-3 fatty acids, quercetin can be super helpful. Then we can dramatically change the outcome. And I've been able, using those tactics, and I'm sure that Dr. Judy has as well, been able to keep patients with mildly elevated creatinine values in stage 1 or 2 iris disease there for years. And that's not supposed to be what happens, right? It's supposed to get worse and worse. And in fact, unfortunately, many of my colleagues will say, just, eat this bag of prescription food and come back in 3 months and let's see if it's gotten worse. There's really not much else that we can do right now. So when you hear that from your veterinarian, even though that they may be saying this from truth in their hearts, that may be the limit of their options, but there are always more options. So Dr. Judy's a great source. I've got a tremendous amount of information on my website. And if you don't know about holistic pet health coaches, I really encourage you to go check that out. These are folks that I have trained to understand the basics of what's going on with your pet. When you're given a diagnosis at the veterinary office, the veterinarian doesn't have options for you. These folks are trained to help you use diet, exercise, lifestyle modifications, supplements, and help you understand what's going on so the next time you go to the vet for follow ups on this condition, you're better able to have a good conversation with that veterinarian. Suki, this is a great question. And I think it is something that is underutilized. So we think about, oh, the only way to really impact the microbiome is to give probiotics. And that is a way, and also fecal FMT, so fecal microbial transplant therapy. But the thing that's interesting is that if we don't have the things that the bugs need to eat in the GI tract and have the terrain set up so that they can thrive, then we're not going to be able to let these guys rebuild the scaffolding, if you will, very effectively. So that's one of the key utilizations of fermented foods. In many cases, if they are not pasteurized, meaning there's not been a kill step, this is a great way to add in some probiotic organisms that are very fresh, very natural, and more importantly, fibers that they like to live on. So if you're using especially like a sauerkraut or something like this, and then there's also something called postbiotics. And what's interesting about postbiotics, and literally means after life. So these are either parts of the bugs, the good bugs that have died, or some of their products. And what's really awesome about these is they are the things that we need to really focus on in terms of feeding the bugs, helping them thrive. So, and using some sort of a fermented food, whether it's a kefir, a fermented goat's milk, cow's milk, any of those things, I think is a great idea. Ruth, there actually I have three, four, five holistic pet health coaches in the UK right now. Kat Jepson has graduated. Sam Giovanni is about to graduate. And Sarah Sharp, who is a registered veterinary nurse, is about halfway through the program. So if you'd like information on how to contact them, check it out at drruthroberts.com. And then there are some really amazing holistic vets in the UK, but much like the ones in the US, they're often quite busy. So, for instance, Nick Thompson, Holistic Vet UK, pretty easy to find. So there's a host of folks. I'm not as familiar with the veterinarians there, but I think if you just start Googling Holistic Vet UK, you'll find them. But this may be, if it's a distance away for you or something like this may be where a pet health coach could be super, because they often will work remotely as well. Cool. So what else is going on? Thanks for the questions. This makes this part fun, and that's what it's for, right? The other perspective that I thought was really interesting. So we started off with a lot of the old heads. So Dr. Eor Basco has 40 years of experience in veterinary medicine. And he's come to the idea that this complete and balance for all life stages in every bite that AFCO and EDF, FDF, the European version of AFCO thinks that, we should have every single bite of food balanced and complete, that it's a load of bunk. And that really, because of the way commercial food is stored, the processing heat, all of those things, there may be that these diets started out complete and balanced, but over time they've degraded. The cooking process often degrades things, and they're using little tricks to get around the ratios. So, for instance, flaxseed is often used to boost the omega-3 content of a food so that the ratio looks good, right? We want to at somewhere around a 6 omega-6 4 parts to 1 part omega-3. So omega-6 we are still very essential, but in high percentages, high ratio to omega-3s, it becomes pro-inflammatory. So flaxseed will lift those omega-3 numbers. The trouble is that people can absorb about 10% of the omega-3 in flaxseed, dogs probably considerably less. So if we've got a desirable ratio of 4 parts omega-6 to 1 part omega-3, and that omega-3 is coming from flaxseed, the real ratio may be something closer to 28 to 1 or 30 to 1 when we factor in absorbability. So I think that was a great way to do it, to explain it and then to start get you thinking about it. The other thing is too, and I really find this difficult, there's a lot of folks that take it as a badge of honor that they're spending more on their dog's health than their own health. And a lot of it is on treats and really expensive supplements and that sort of stuff. Listen, I make supplements, but supplements are supposed to be just that, supplemental to the diet to help fill in gaps. So, one of the other things that Dr. Basco talked quite a bit about was how to do holistic pet care without breaking the bank. And I think that was a really, really useful topic, or that part of his talk, because in this day and age where things are a little bit crazy in the economies, it's important to know how to take care of things as much as you can for yourself. And also, when you do need to go to the vet, how to make the most out of that appointment so that you're getting the biggest bang for your buck, you're helping your veterinarian be efficient, and you have some idea about what might be going on with your dog so that you can support him or her better. Now, one of the other things that Dr. Tobias talked about, which I thought was quite interesting, there's a lot of sort of antagonism against any type of synthetic vitamins. And what Dr. Tobias said is that we can't expect to get all of the nutrients from our food anymore, and nor can our pets, even if we're feeding them a completely fresh diet, species appropriate, which to me means also vegetables, beans, grains, that sort of stuff. And I know I'm sort of unique in that. Actually, Dr. Borer with She Dog would agree with me there. But he feels that really we still need to use at minimum some minerals to support, because that has been stripped away from our soils and our food supply. And so he's taken the approach of using fermented supplements. And really what that means is that the thing that we want in that supplement, so in his case, he's doing minerals again. So it may be stuff like magnesium, copper, calcium, those kinds of things. You take those, put them into a fermentation vat with bacteria, and then the bacteria produce those in a more food-like substrate, which is a super interesting concept. So that was a really cool. And then he shared his story about PAX. Did you guys cue in on that? Did you like that story? If you missed that one, I think it was really telling. And this is part of what started him down this path of passion about spay-neuter syndrome. So he thought he had everything dialed in for PAX. The food, the supplements, the nutrition, the exercise, the physical stretching, his own mindfulness, all of those things. And so PAX got to be 2 years of age, and he thought, okay, he's old enough now, I'll go ahead and neuter him. To his horror, about 6 months later, he noticed PAX just didn't look good. His hair looked rough. It wasn't shiny anymore. His energy level was going down. He just didn't feel good. And he was hiking one day with it was a great story, Dr. Becker and Rodney Habib. He went to get PAX out of the back of the truck, and he just collapsed on the ground. And they're thinking, oh my God, what's going on? Couldn't find anything. Tests were all normal. X-rays were normal, all of that stuff. And so he started researching and found the Parsimus Foundation. If you don't know that group, they're amazing, and started asking questions. And then finally realized, oh, wow, okay, luteinizing hormone levels go way high. So he tested PACs for that, and lo and behold, indeed they were. Now, because Dr. Tobias spends part of his time in the Czech Republic, he has access to something called desmorelin or supralorin. And this is a gonadotropin releasing hormone inhibitor, which I know is a mouthful. But why that's important is this. If your dog no longer has ovaries or testicles, they normally produce estrogen and progesterone and testosterone. And those levels of hormone come up and tell the hypothalamus, hey, you're good. You're producing tons. We've got tons of normal hormones out here. You can shut down production of gonadotropin releasing hormone, or GnRH. And so what that does is then downregulate the hormone production. That GnRH goes first to the anterior pituitary, where luteinizing hormone and follicle stimulating hormone, so two hormones we normally associate with the female dog coming in heat, producing fertile eggs, all of that, but also for male dogs in terms of producing normal sperm. So, excuse me, when that hormone level starts to drop, then everything goes back in balance. Now, if your dog is spayed or neutered, that shutoff mechanism is gone. Sorry, I picked up your British bugs, Ruth. And so when that happens, luteinizing hormone levels just skyrocket. And that's one of our indicators that our dog may be suffering from spay-neuter syndrome. And that maybe, just maybe, that broken cruciate, the intervertebral disc disease, the Addison's disease, the Cushing's disease, the liver disease, the kidney disease, the cognitive dysfunction, the anxiety, the behavioral abnormalities, the aggression, the IBS, the skin disease. Do you see where I'm going with all of this? Basically, every single system which has a chronic disease is having these chronic diseases because luteinizing hormone levels are astronomically high. Thank you. And the receptors for luteinizing hormone are developing on tissues that shouldn't have them. And so this work, I mean, this is not science fiction. Dr. Michelle Kutzler did this work. She's continuing to do more work and showing us where these problems are coming from. But Dr. Tobias did a great job of telling us how this looks to a pet parent. So he's been able to use supralorin and I believe some testosterone. So basically, hormone replacement therapy for PACs to get him back to happy, healthy, and vibrant. So super, super story. Let's see, what else? What else is going on? What can I help you with? What burning questions are you all dealing with your own pets? And essentially, I just gave you a synopsis of my talk. But that's why I've been so passionate about it. We started to see papers about this in 2013, and indeed, I could not understand what was going on. But this research by Dr. Kutzler really helped us put it together. Let's see, what else can I help you with? You guys are quiet today. So who's been hearing synthetic vitamins are all horrible and evil and awful? Yeah, supralorin in the US is available for ferrets, Audrey. So if you have a veterinarian that's been doing some research, or even if they haven't, you can send them the supralorin website in the UK, which is verbac.com.uk, I believe, or verbac.uk. And that's where this research is that Dr. Kutzler's done. And they can give it to your dog off label. In an intact dog, which is what this medication is meant for, is it will suppress gonadotropin releasing hormone again, and what that's gonna do is in the intact animal is, for males, drop their testosterone levels down considerably, and for females, drop their estrogen and progesterone levels down. And what that will do is keep the females from going through a heat cycle, and it will sterilize the males. They're unable to produce viable sperm because of, um, because they don't have enough, precursor hormones to do that. And Sam, one of our coaches actually in the UK, you should connect with Ruth, interested in oral health in cats and tongue reading. That is a trip, right? So if we think about tongue and pulse diagnosis in Chinese medicine, it's a little bit more difficult with cats because they have all those spikes on their tongues. But basically, what you want to do is look at the colors that are present. It should be peach color, so nice, healthy pink, to dark pink or red means heat in general. And there's also maps that you can find where they associate different parts of the tongue, the tips and the edges with different organs. So that helps you understand if there is phlegm on the tongue. That typically means that the spleen is not working well, the digestive organ. And so that phlegm accumulation is because the spleen is not functioning optimally, and it may need things to help dry up damp and also to warm things up a little bit. And then in terms of oral health for kitties, this is a challenge because when we see yucky teeth or inflammation in the mouth, we want to think, oh, I got to do something in the mouth. But often it's starting in the gut. So I would look at things like there are great provolone sprays. So ingenious probiotics can be helpful orally, and then working on the gut as well. Tanya's dog is struggling with allergies. I think microbiome testing and intolerance testing, and actually, Tanya, I would do intolerance testing first. And then after that, not sure what to do. 3-year-old intact male Roddy. Good for you that he's intact. That's going to help him tremendously. So there is a company we like. Oh, poor Buddy. Soft schools, skin rashes. What a cutie. And that lasts for a week with runny eyes. So interestingly, skin disease and gut disease go hand in hand. And the reason is that the epithelial cells, so that's here, but they're also in lining the intestinal tract. So the enterocytes or intestinal cells are a type of epithelial cell. So if there's gut dysfunction, then what you're able to do is use that sensitivity testing to help determine which foods may be creating a problem. And the interesting thing is that if you're in the US or Canada, Glacier Peak Holistics, actually, I think they will ship internationally, is a great way to go because it's a fairly inexpensive test. It's about 130 US dollars. And you're able to get food sensitivities for over 200 foods. I think there's a total of almost 370 different items on that test now, which also include environmental allergies, petrochemicals, other, pesticides, herbicides, all of that stuff. So it's an incredibly useful test. And then from there, what I would generally recommend is doing something called a rotation and elimination diet. Excuse. I'm going to grab a glass of water. Apologize. Thanks, Ruthie. You couldn't do it for me. So after you use that rotation and elimination diet, then you're able to use a few other things to help rebuild the gut. And then one of the things I really like is quercetin for itchy skin. It does help alleviate the symptoms. And I think it is really critical that you go through that step instead of going first for the skin. use things that will help alleviate the itchies, the scabs, that kind of stuff. Again, bathing, apple cider vinegar rinses, which are awesome. And those are super simple. An ounce of like Bragg's apple cider vinegar to half a gallon of water. So do a nice bath with a gentle shampoo and then rinse that off and then just sponge the rinse on and let that dry on him. That tends to help make the pH a little more alkaline, which will kill off some of those bugs. Um, Also super helpful for yeasty patches, that kind of stuff. So that would be the way I would start. There's a multitude of ways, and the reason I would wait to do the microbiome testing, excuse me, until you've had a chance to do some of these other steps, is that just taking those actions is actually going to shift the microbiome. And then once you've done that, then I would do the microbiome testing and consider fecal transplant or probiotics and or another mix of things. One of our coaches has sort of specialized in homemade but specifically targeted probiotics for your pets, which is really cool. Um, Suki, this is a fantastic question. How proper nutrition can support pups with anxiety, especially pups in shelters. And I think this is way, way, way under discussed. So if we know that our microbiome gives us something like 70% of our immune function and 90% of our neurotransmitters, this should be just not a discussion point, right? If we don't have proper nutrition in the belly, then we're going to fight tooth and nail to get behavior, and in this case, anxiety, reduced. Now, there's a lot of discussion about what is proper nutrition. And one thing I would tell you is that it's different for many, many pets. And so proper nutrition for one dog may be different from another dog. And especially when you combine things like hair mineral testing, you get a whole different set of outcomes. Now, as I said, I come from a tradition of cooking food, and for me, that's what's worked best. I've healed a lot of raw guts with cooked food, and I've seen a number of my patients that didn't do well with cooked food. So the deal is not getting too centered into your dogma. What's difficult, and especially in a shelter situation, is that many shelters rely on donations of food, and often it is kibble. So, what can you do in a shelter situation if you're able to help support these guys? Well, one thing is just cooking some vegetables. And one simple way to do this is Normandy blend frozen veggies. And so you've got a mixture of broccoli, of cauliflower, of zucchini, of yellow squash, usually. You just throw a handful of that in some boiling water or pre-cook it up. You can blenderize it and then just pour this over the top of the kibble. So we're starting to give these guys some fresh veggies, some colors that are going to support feeding their microbiome. This is where you could come in with just a simple over-the-counter yogurt, and that's going to help tremendously in terms of what we talked about earlier, right? Probiotics, prebiotics, postbiotics, all three in there. So there's a bunch of different things you can do. And then, and then you can get into supplements. But if you're in this setting of a shelter, these are things that can help reduce their anxiety. Omega-3 fatty acids are super helpful as well because they're going to reduce inflammation and start allowing the brain to help kind of revamp. So super good question. Right on. So Susan, welcome. Glad you're here. Best shampoo for seborrheic keratitis. That is a tough one. And I'm going to say something that may make you scratch your head a little bit, but I used to use Selsun Blue in practice. If you're in the US, you probably know what that is. But it is a shampoo that has ingredients in there designed to reduce the growth of yeast, and it and to kind of strip the grease away from the skin. So, what I would often suggest to my clients is to use something like that first, and then something that's a little bit more restorative later. And then you can, again, this is a great situation to use an apple cider vinegar rinse. Um, so let's see, it looks like Susan's done a hair analysis for her zinc level, and that was low. And she's on a raw diet, green juju. Rescued her at the age of 10, had her for 13 months, and she's also got megacolon. Poor sweetheart. Um, so here's where I challenge you. If you've been doing these things for quite a long time and you're not getting the results you're wanting, and then what I would do is switch it up a little bit. So megacolon can be associated with thyroid dysfunction, and I guess are you speaking about a cat here? But this is where, just looking at a hair analysis and, oh, her zinc is low, that may well be true. But with those hair analyses, what's important is the ratios between the minerals. And so zinc may be low because something else is way high and out of balance. So I think that's where you may need to go back and revisit that interpretation. And then if you've been using raw diet for quite some time, then consider sensitivity testing for food and then using a rotation diet. And again, if you need help walking through that, that's what the holistic pet health coaches do and what they've been trained to do. Let's see, Sophie, welcome. 9-year-old border collie Aussie has arthritis. 2 shots of Librela, which caused excessive panting. Long-term carprofen caused thinning blood. He's been raw fed and carnivore meat and organ for 3 years and is obese. Now, this is fascinating to me. So what can you do for his pain? Take a deep breath and pat yourself on the back for realizing that what you're doing isn't working. And that's awesome. So he's been diagnosed with hypothyroidism, so he's taking levothyroxine, and he is starting to lose weight. Here's something really interesting about raw diet that most of us don't think about, and that is that beyond a certain percentage of proteins, where your dog's amino acid needs are met, protein gets turned into carbohydrate, and then that carbohydrate gets turned into fat. And so this is where using more vegetables in the diet can be super helpful for 2 reasons. One is it will help fill him up with a lot of fiber so he's not feeling so hungry. And the other is that we're going to start feeding the microbiome. Now, second thing is that oil is the thing, fat is what tells our brains that we're full. And so if we're on a high meat diet, but it's lean meats, he may not be getting enough fat in his diet for his brain to know he's full. And that may be part of the overeating. Now, what you really asked me about is pain. And so, again, this is multifactorial. I think one of the best things you can do is look at that PETS PEMF mat. So it's a pulsed electromagnetic field therapy. And there's a couple of settings there. One is to work with pain, and one is to help accelerate healing. And then there's another setting actually for anxiety and stress control. So I would check that out. CBD is an amazing option in terms of supporting pets that are having pain. Long-term omega-3 fatty acids are super helpful. And I'm going to sound like a broken record, and I'm sorry, because what we're doing is working on the same mechanisms, right? So if our underlying mechanisms for pain, skin disease, IBS, all of this are inflammation, the inability to detoxify properly, and the inability to digest and assimilate our food properly, then we're going to still be working at those root cause levels. So we've got a ton of information on that, but those are the quick fixes. I think CBD, you will see some pain relief. The other thing that may happen when he gets good pain relief is you may see his appetite actually drop, right? Because he doesn't know what to do to make himself feel better. So that's something that can be super helpful. But there's a myriad of options out there for sure. I hope that's helpful for you. Cool. Yeah, so you're planning to get a puppy in the future and raw feed. Um, it can be hard to raw feed up to 6 months. So I'm going to throw a little wrench in your plan, Ruth. Again, I teach home cooked diets, and I think there's a lot of value in bones and raw food. It can be a little harder to keep up with these guys. But what I would suggest is that you look at more vegetables than you think, and you look at mixing in a few other things to help make his microbiome as diverse and rich as possible. So what's super interesting, the research that the folks at Animal Biome has been doing, is that in every study, raw-fed dogs have a much less diverse and much less rich microbiome. Dogs that are than dogs that are fed kibble. I'm sorry, and that makes me sad to say it too. But you don't have to feed kibble, right? You can cook for your dog. You can use what you think is appropriate. So for me, I like beans for dogs for a couple of reasons. One is that they are what we call a slow burn carb. And what that means is because there is so much fiber in beans, the release of sugar impact from eating beans is smooth and prolonged. And so, for many reasons, that's super beneficial. What we're seeing on the human side, and if you look at Tim Spector's work, he's from the UK as well. It doesn't matter if you're a vegan, if you're vegetarian, if you're keto, if you're carnivore, if you're Mediterranean, if you're this, if you're that, or the other. The thing that seems to really extend lifespan is the amount of fiber that you eat on a daily basis. And the target number is 30 grams of fiber. Most Western diets, people get somewhere around maybe 12 grams of fiber. Now, that sounds nuts when we're talking about dogs, and the current line of thought is that the only species appropriate diet is raw. So I'm going to give you a little background on why I think this. One is that dogs evolved with us humans. We inherited fire from the Neanderthals, and we've been cooking all of our existence. There's evidence of baking bread 30,000 years ago. And what that means is that people were gathering grains, pulverizing that into flour, and then making a bread from it. Dogs diverged from wolves somewhere between 15, and 40,000 years ago. And yes, indeed, raw is absolutely their ancestral diet. It's also our ancestral diet for two species prior to us. So when dogs evolved with us, we've already been cooking. They started by eating our garbage and our poop, which is why their microbiome is more similar to ours than most understand. And then finally, they kind of moved in. We actually started hunting with them. There's a theory that that's how the Neanderthals disappeared, that Canis familiaris and Homo sapiens really killed them off. So they started eating our garbage, and then our leftovers, and then finally what we fed them. And what we started feeding them in the last 70 years is what the problem is. So if you go back to the early 60s, late 50s, and look at Juliette Barclay-Levy's work, she did promote feeding raw meaty bones, and she is the woman that coined the term natural rearing. She also was a tremendous herbalist. But if you look at her diet, it was raw meaty bones, milk, grains, wheat, oats, corn, herbs, and then and then she fasted on a routine basis, but she fasted with what she called honey water, which was water with a mix of like an herbal tea often, plus honey. So literally that. So it may be easier for you to keep up with a more diverse diet. And there's nothing wrong with really diversifying the diet so that maybe sometimes it's raw, maybe sometimes it's cooked, maybe sometimes it's a freeze dried product, something like this. So I think that is better. The more foods that our dogs and our cats eat over a given week, and us, the more diverse our microbiome is. So I think that is really critical to understand. We get into these things of like it's only this way, and that's what I'd like you to understand is that there are many, many ways, and for an individual, one or more of those will be the right option. I hope that makes sense. Um, Sam, awesome. 9-year-old German Shepherd's had diarrhea for the last 5 days. Um, so this is interesting. So I think it's a good idea to go see the vet just to make sure that there's not something like intestinal parasites at play. And if it's really interesting, so metronidazole, which was kind of always the standard issue prescription for diarrhea, there's a paper out there that shows that there is no benefit of metronidazole over probiotics. And so that's an option, is to use some sort of a um, binder, like a clinoptilite, activated charcoal, something like that. And then 2 hours later, a dose of really high quality probiotics. And so doing that back and forth twice a day. But the deal is that if she is sick, she doesn't feel well, she's not eating, she's not drinking well, she's hot, you should encourage folks to go to the vet because that can turn into a dangerous situation because this is a 9-year-old German Shepherd, and there's a myriad of reasons she may be having diarrhea other than just she ate something funky. So that's a great question, Sam. Thanks. 12-year-old. All right, cool. So, Susan, that's a very astute understanding. It came back low, but maybe low to an under due to an underlying problem. And so, what I think is important is if it's low and there's no obvious overt problem, I would consider natural desiccated thyroid just to see if that doesn't help her feel better, because there's definitely something weird going on. Um, and 12-year-old German Shepherd, sadly, have done very well to get her to that age. So I think a desiccated thyroid is a great option if your veterinarian is comfortable with that. Most vets will use Synthroid, and that's still a good option, but um, it is what it is. So you just have to take what's in your court. But I think that would be a good move to help support her feeling better. Uh, let's see. Not sure what's next, Jindy. This is great, y'all. Super. So what type of beans? All beans. Lentils are the easiest to digest, and I'm going to give you a codicil in just a minute. Lentils are the easiest to digest, so I would start with those and start small, y'all. If their pups are not accustomed to them, you literally, like for a 10-pound dog, maybe you're going to start with a half of a teaspoon. So kind of mush things up a little bit and mix that in because we're introducing a ton of fiber with these things. And when we do that, if the microbiome is not accustomed to that, they're going to produce a ton of gas, which can be very, very uncomfortable. So start small, work your way up. If you're using this in connection with a batch of food, maybe a tablespoon is going to be a gracious plenty for a 50-pound dog every day. Maybe it's going to be a teaspoon and a half for a 15, 20-pound dog. You're going to have to just sort of adjust and see what works. Now, here's the codicil. If your dog has had a lot of gut problems, beans are higher in lectins, and there are other vegetables as well than some of the other foods. So go, again, very slowly and cautiously. If you know that there are some GI problems and the symptoms get a little bit worse, then beans may not be appropriate at that time, but they may be later as you resolve that gut health issue. Cool. What else we got going on? Ah, wow, Nancy, that's a tough one. I cannot remember if Supralorin is available in Canada or not, but I would honestly talk with your veterinarian about that. And again, go check that website out. So if you go to Virbac, VIRBAC dot UK or .com.uk, I can't remember the suffix right now, and check out a medication called Supralorin, Suprelorin. That would be very interesting to try. And these are given by implant, and the implant is good for about 6 months. And so what I would expect you would see is that over the course of 2 months to 3 months that your dog comes back, and you start to see them behave more normally. And in the meantime, I would do everything else in my power to improve the microbiome so we get those neurotransmitters back online. Again, Pets PEMF is a marvelous option. They have an anxiety setting. And then working with a trainer that is well versed in behavioral issues would be critical as well. So that's a tough one, and that's really heartbreaking to hear about. I'm so sorry you're experiencing that. Cool. Last question coming up. Right on. Ancestral supplements thyroid, I don't know. And so the deal is that if this is like there are some non-dethyroidated, I'm sorry, that's a really strange way to say it, thyroid supplements, meaning we're giving raw materials to the dog's body so that it can support its own thyroid function. That may be helpful, but it still may not be enough. I have hypothyroidism, and I am here to tell you it really is not fun when my meds are out of balance because I just don't feel well. And everything else gets impacted: gut health, skin health, mental health, all of those things. So I think it's important to use something that is standardized, so that the dose is not shooting up and down, because that does not feel good either. So again, Synthroid is the trade name on the human side for levothyroxine, and there's a couple of names on the veterinary side, or natural desiccated thyroid or Armour thyroid. Cool. And here we go. Our last question for today, Tanya. 3-year-old intact Roddy, never had form stools, allergic to everything, gets rashes on his face that last for a month. Yuck. Yuck. That's right. So we did talk about this a little bit. So, Tanya, honestly, work with a coach. If you're in the US, go to drruthroberts.com, click on the tab that says Find a Coach. You need somebody to help you get through this process. You have been trying and trying, and the options you've come up with haven't worked for your buddy, and you need to get somebody to help you lead you through this. And good for you for cooking. It's tough to keep up with, especially for a big guy, but there's something that is still not optimal for him. So let's see what we can do to get you some help. Hey, y'all, I am so delighted you joined today. We're going to be back tomorrow morning, same time, answering some more questions. We've got tomorrow, or today coming up, I guess, actually, is common TCVM herbals, formulas for everyday use with Dr. Chris Besant, a really good friend, common conditions supported with herbs, and a home emergency kit from Rita Hogan. If you haven't checked out her book, The Canine Herbalist, you need to go check it out. It's a marvelous book. She's doing a fantastic book tour right now as well. And then Dr. Silver is going to be back with selecting medicinal mushrooms for specific health concerns, and natural flea and tick control with Megan Barrett. And super, super fun. Again, super big shout out to our sponsors, which are Chi Dog, Pets Pimp, Well Pet Dispensary, and Animal Biome. Super amazing people working hard to help you support your pet in the best and optimal way possible. That's it for today. Hayo and I will be back to answer your questions about the talks today and any other questions you've got. Thanks so much and have a fantastic day. Enjoy the summit.